Common types of ventricular septal defects are perimembranous ventricular septal defect, muscular ventricular septal defects, inlet ventricular septal defects, and outlet ventricular septal defects. There is a rare variety known as intramural ventricular septal defect or intramural VSD, which is a VSD extending through the muscle from the left ventricular outflow tract down to the right ventricular cavity. It is a post-operative residual ventricular septal defect which occurs after repair of double outlet right ventricle, truncus arteriosus, or even after Rastelli procedure for transposition of great arteries. It's a special form of post-operative residual ventricular septal defect. Intramural VSD occurs after surgery for conotruncal anomalies. The patch is attached to a hypertrophied right ventricular trabeculae. There is an incomplete seal and a channel can persist from below the aortic valve in the left ventricular outflow tract through the muscle. That is why it is called intramural, and it can exit into the right ventricle at one or more points. The blood tunnels between the trabeculae of the right ventricle. This is difficult to locate by either transthoracic or even transesophageal echocardiography sometimes, and it is also difficult to close surgically because of incomplete seal of the patch onto the right ventricular aspect of the ventricular septal defect. High parasternal views on transthoracic and deep transgastric views on transesophageal echocardiography are often needed for delineation of the intramural VSDs. The defects can increase in size over time and more shunt can be established. As it is difficult to eliminate by surgical repair, it can contribute to morbidity and mortality after the repair of conotruncal anomalies. As these VSDs are not accessible through aortotomy or even right ventriculotomy, transaortic closure has been advocated. Many of them require intraoperative transesophageal echocardiography for identification. Even then, sometimes some intramural ventricular septal defects can be missed.